Migration studies show longevity is about 3% genetic. How do we know that? Well, the simplest example is there's two groups of people that we've researched over the years. One of them is African Americans, and there was a doctor called Dr. Burkett. He went over to Africa and he studied rural African tribes for about 20 years. He couldn't find anyone with Crohn's disease, IBS, IBD, bowel cancer, constipation, anything. Couldn't find any. Went back to England, wrote a book about it, about all these different tribes of people that he studied. And then you look at the American stats for bowel cancer, and you look at the American numbers, and you look at, okay, well, who's dying the most of bowel cancer in America with all these different ethnicities and races? And you notice when you look at America, the number one race that dies of bowel cancer is African Americans. And they're so far ahead of any other race. Now, again, you go back to Africa and you look at the African American squatting when they go number 2, right, which is the natural bowel motion to clear your bowel. When your right leg hits your appendix, your left leg hits your sigmoid colon and moves all that waste out. This is why you see babies, when babies go to the toilet, you notice when they're, like Robin has just started walking, our little 1-year-old, she's actually 11 months, very advanced of course. And so she's walking and she does this, right? She's walking, when she wants to go to the toilet, she's like, she doesn't run around looking for a toilet to sit on, because the natural inclination is to open the bowel and clean it.